your own.
I think we're all set.
Okay, well, welcome to Dry Eye Happy Hour, everybody. I'm Rebecca at the Dry Eye Foundation, and Aiden's with me here. For once, he's not on the other side of my wall. Aiden's at home.
It's true.
And let's see, this is going to be a little bit different Dry Eye Happy Hour. We are just kind of winging it today. Originally, this was going to be, we wanted to do a thing with the foundation board and have them introduce themselves and talk about what we're doing. But there was one member that just, it wasn't going to work out on a Friday. So we ended up rescheduling that. We're still firming that up and decided to just reserve today for anybody that wants to come in and chat, whether you want to share what's going on with your eyes or share a new thing that's helping or whatever goes. We've got lots to share too, just about people we've talked to this week and things that are going on. So either of you that are here, do you want to be to come in on video? Just let Aiden know. Let's see. So we've had a really busy week here. I mean, we had obviously Thanksgiving week last week, short week, lot going on, shut down early on the day before Thanksgiving. I actually spent 3.5 hours at a new eye doctor's office, a surgeon in Seattle that day, which is interesting. Then at the shop, of course, we had Black Friday, Cyber Monday, which was crazy. So we've just had a really super busy, packed week today, but a lot of great conversations with people. And I'm just kind of scrolling through the list. I had some neat people just today that I talked with as well. Aiden, anybody particular you want to share about? You want to kick this off?
Yeah, I'm just looking at the notes here. Oh man, I've had tons of funny stuff this week, just from helping people with donations and just learning more about people's situations to
that's right. We had
products.
Tuesday. I was touched by some of the donations that rolled in. It was really something.
Yeah, I was telling Rebecca we had our Thanksgiving, Black Friday. We skipped our small business Saturday, Cyber Monday, and Giving Tuesday. It's like a lot for everyone who does it all. Like
it was just one straw too much. Couldn't quite deal with that. I'm looking at the call log right now, and I see Marcy from somewhere in Canada. I forget where is she, in Toronto?
Toronto. Yeah.
But known Marcy for donkey's years, it feels like. She's gone through an awful lot with her eyes, but I just love seeing her name pop up. We've talked so many times, and a lot of other familiar names here.
Right.
Had an interesting call today. Actually, somebody who's been on the phone with us a couple of times, but it was my first time speaking with her. A gal who's had some longstanding vision issues, a number of other health issues, some of them related to a head injury from years ago. Also has severe dry eye, which she didn't get diagnosed or get help for until someone helping her with some complex vision issues mentioned that this was looked like a serious thing and found a dry eye clinic for her to see. And so she's making some good progress, but she's now trying scleral lenses and is going through some special challenges because all of those of us who have worn scleral lenses, we know this is a complicated thing. It's a costly thing. There's a lot involved. There's a lot of different solutions we have to get. There's just kind of a lot of maintenance, a lot to it. So anyway, she got her first lenses. She's well along in the process. She's on a fixed low income and had to do these lenses on a payment plan. So money is tight, and didn't know until a fair way along in the process how much was involved and how many things are involved. The types of solutions we have to get, how expensive they are, the fact that you can't get them in your local drugstore. There's just a lot there. So it prompted a lot of both fresh and old thoughts about how we find more and better ways to bridge some of these communication gaps So patients can get the information they need up front about stuff when they're launching into things. And thankfully, I think she's finding some good solutions to issues and things, but just there are these areas where the practicality of some treatments are a really big deal. And as we know, in dry eye, costs are a big deal for all of us, really. We've got a lot of over-the-counter stuff we have to get, a lot of things that are not reimbursed by insurance, a lot of things that have very expensive co-pays, just a lot there. You have any particular call you want to share about, Aiden, or I'll just find another one?
Well, if you want to keep going with that, I mean, so that it's hard for me to do this without naming names, but that person you were talking about just there, I talked to her a couple times on the phone, and she'd emailed in before that. It was
She's really neat, and one of the things that I was really feeling today was just how much I appreciate our community and all that people want to pour in, because talking with her, I just talk with her in the knowledge and confidence that if she's got needs for things that she can't afford in the way of like scleral lens solutions, we've always got people. If I put out a need in a newsletter and say, hey, we've got somebody who's got some needs here. Anybody want to be a sponsor? Anybody want to, buy her a gift certificate or something? There's always people that respond, people that have had their struggles with this and want to pay things for it. So it's just really neat to be in a situation like that and know, without ever having asked anybody else first, just to know that there will be people that want to help. And that was really fun. Let's see, what else is going on? I have had a lot of thoughts rattling through my brain lately about artificial tears. And this is prompted by a couple things. A week or so ago, I participated in an ophthalmology podcast. It was this kind of Europe and Asia thing. It's a podcast for ophthalmologists. They were doing a series on dry eye, and the third in the series was trying to incorporate the patient perspective on dry eye. So there were basically two ophthalmologists and myself, and we just had a really fun discussion on it about some of the needs of the dry eye community. And this one ophthalmologist was, he's like head of ophthalmology at one of the major Paris hospitals, so I forget which. And he talked at length about the importance of doctors getting involved in these decisions about which over-the-counter tears we use, and the problem of so many doctors basically acting as though they're all alike and don't matter, where he felt it was actually pretty important both to understand that there are differences between drops and that the doctor be involved and have a conversation, and that be something that goes on between doctor and patient in dry eye, not just go get some artificial tears, doesn't matter whichever one you like, and treating them all as just basically different flavors of ice cream or something. I thought about that afterwards, and I was thinking, to what extent have I kind of fallen into that same thing of just thinking this is all about patient preference, period. There's an extent to which I think that's true, because we've got tolerance difficulties. We've got, some of us are sensitive to certain ingredients, or we have a hard time tolerating more viscous drops, or we've got to avoid one particular thing. Some people are allergic to glycerin. There's just a lot of things that go on that can limit what we use. But the positive side of it, the idea that eye drops, over-the-counter tears could actually act differently, that kind of gets lost sometimes in the noise. And I myself often, I think, just kind of blow off some of the hype from some of the manufacturers about here's how R1 acts and how it addresses all three layers of the tear film and all this stuff. You just get kind of jaded after a while. Then the other ophthalmologist that was involved in that, we've kind of crossed paths in some other contexts. And he emailed me afterwards a couple of studies, one that they published recently about artificial tears. So this is an Italian ophthalmologist that I really like. He's involved in TFOS, the DEUCE 2 effort and things. And it actually broke down artificial tears into a few different classes and talked about how they act on the ocular surface. It's really interesting. I'm still trying to find some time to blog about it and kind of get it out there on Dryazone in some kind of compact format that's just easy to digest. But between the two of them, they really just brought my attention back to the importance of what you're putting on your eyes, and that actually plays a role in the treatment process. So treating dry eye isn't just about the prescription drops and the procedures and all these things. Even over-the-counter products can be part of that treatment plan in terms of how things modulate inflammation and one thing and another. So anyway, that's just an area I've been thinking about a lot since then. Then this week, two different calls that I had, I kind of think they were on the same day. Two people I talked to were struggling because they are experiencing a whole lot of burning and discomfort with pretty much anything that they put in their eyes. All over-the-counter drops that they've tried just bother their eyes horribly. And they both tried to talk to their eye doctors about it and felt like they were getting blown off. So in the one case, the gal just didn't feel like anyone was listening or cared. In the other case, this other gal had been to, I think, 4 different ophthalmologists, one of them a cornea specialist, and one of them just told her point blank that basically you can't have an allergy to artificial tears. They can't do that. And it bothered me because I know that these things do happen. There are ingredients in tears. There's buffers. There's even some of the active ingredients. It is possible to have issues with them. And I think that reactions to artificial tears, if there's something in it that's bothering your eyes, what you feel and experience when that happens can sometimes just get lost in the noise of broader dry eye symptoms. If your eyes burn and hurt a lot of the time anyway, it can be hard to sometimes catch up with the fact that something you're putting in your eyes might actually be making you feel worse. And it's just, like I said, lost in the noise. So anyway, those are just kind of anecdotes of thoughts I've been having about artificial tears and the need to just be observant and have conversations with our eye doctors about them. All right. Did we have anybody that wants to join yet, Aiden? Or?
Oh, I had a couple more people join. I haven't gotten any messages or raised hands or anything, but happy to have
names.
Familiar names.
Holly, hi.
Happy to have anyone join the conversation here.
Let's see, thinking about other calls I've had this week. Right. The gal I mentioned, who is one of the ones that was kind of having adverse reactions to some of the over-the-counter tears, made me think about just what things look like when people first start out in this. I mean, she's had an issue and it's only affecting one eye, and it's been 4 months, and she's been to 4 different ophthalmologists multiple times each. I think we all know just the extent to which this can mess with you really quickly when things start tanking. And it brought me back also to the problem of confusion about diagnosis. Say you go to 4 people and they all tell you slightly different things, or maybe dramatically different things. Putting that together is hard and stressful. We end up having to be the ones in the driver's seat trying to decide, I don't know, who's right and to what extent. It's like we need somebody with that bird's eye view to say, here's how to relate these different opinions to each other. And I think, personally, I think often it's not that the opinions are necessarily contradicting each other. There's just differences of focus. One doctor's going to be really super attuned to any sign of meibomian gland dysfunction. A lot of that going around, and with good reason, because a lot of dry eye really does go back to meibomian gland dysfunction. Another doctor, and these I wish were much more common than they are, is going to be more attuned to you having a poor blink or your lid's not closing fully. Some doctors are going to start thinking right away about an allergy component. Some are going to be looking for more kind of for signs of what's going on the cornea. Others are going to be looking more for, do we have any kind of systemic disease going on that relates to this? There's just so many different angles you can look at dry eye through. And because there are so many different things that cause or exacerbate dry eye, they can all be right. And then it comes down to which one of these things matters most. What do I address first? How do they put together a treatment plan that's going to tackle things in the right order? Or is any of this actually extraneous information? The gal I talked to, I think this was the one. Yeah, one of those doctors thought it was conjunctival chalasis was the issue and really wanted her to go into surgery to get that removed. But she's really young. And the chances of that being the main reason for it, it just seemed questionable. But sometimes it's just really hard to navigate these different opinions and views and directions that we get. One of the things I really appreciated in an earlier Dry Eye Happy Hour session, and you might be able to help me remember the name of the guy that brought this up. He was so good. He talked about assembling a team to deal with dry eye. It was not just eye doctors. It was your whole team. I mean, it's your medical team and then, support and all that. But on the medical side, getting your PCP involved, making sure that they know. You never know who in the medical world in your life might actually know something useful about this. Or on the other hand, you sharing information with them about your experience may make them more sensitive to the issues and be kind of keeping their ear to the ground more about it as well. Another gal that I talked with this week in Florida who was just having horrifically debilitating dry eye symptoms, just having a really hard time, missing days of work. She's a full-time nurse in a long-term care facility and just really having a hard time. Started trying to pick through her history to get some ideas of things she could talk to her doctors about and found she gave me the list of medications she's on, and darned if almost every single one of them wasn't a cause or contributor to dry eye, potentially some major things there. And so on the one hand, I'm wanting to let her know, hey, some of these drugs can be part of the dry situation, but I don't want to scare her or make her think, oh boy, I just need to quit all these drugs and I'll be fine. When somebody's in pain, they will do anything to get that pain under control. So instead, it was more about kind of steering her to have some conversations with her medical team in general. There's a cardiologist, there's her PCP, there's others, and say, I'm having really bad dry eye. I understand it's possible some of the medications I'm on might be making it worse. Is there any possibility that there are alternative drugs that might have a little bit better side effect profile that we could maybe look at? It's just those challenging balances. But I think that a lot of us have medical resources in there that we may just not even have tapped yet. Thinking about myself, I don't know that I have ever had a conversation with my PCP, shame on me, about this. And I'm realizing, I really need to do that.
I think it was Justin who brought that up last time. Yeah, about assembling the team. That was a good soundbite from that one. And I know Rob has said before about therapists or counselors or whatever you want to call them relating to chronic pain, even if they can't relate to dry eye. So that can be another source of support in your team arsenal.
That's really good. On the mental health care side, therapists and whatnot, I think that phrase dry eye, just like in so many other contexts, it just really stands in the way of getting help and getting understanding sometimes, because it's just such an easily misunderstood phrase. It just sounds so innocuous. Very different to say, I have a complex ocular pain problem. I have ocular surface pain issues, chronic eye pain. That's a different thing. You're right. Yeah, they can relate to that more.
Yeah. Looking back further in the call log and actually looking for just specifically the foundation calls, I reminded myself of there was a couple weeks ago, we got a call from like a family member, caregiver for a younger kid who was dealing with dry eye and kind of very quickly went into that spiral of self-diagnosis and seeing lots of doctors, specialists going all over the place. And it was interesting because this one specifically resolved in us never really having them connect to Rebecca. Seemed like they resolved their thing on their own or reached a better place. But I kind of remember that from a couple weeks ago. And it was someone who actually kind of found us through happy hour. So I always like to bring up that point where we just get in touch with new different people that we might not otherwise meet through these Zoom calls, which has been a really good side benefit of having them.
The gal in Florida with all the medications, I asked how she found us, and I loved that she actually came across the foundation just by Googling something related to it. I mean, that sounds like a no-brainer, it's Dry Foundation, right? But I mean, you Google dry eye anything, and there are 10 million hits, and foundation hasn't been around that long. So I was just really pleased that it came up and that there was some place that she could call. So let's see. Another highlight from my week was a few days ago, I participated in what they call an ad board. It was this thing that a major pharmaceutical company that's pretty heavily invested in dry eye put together. But it was the first time they'd ever put something like this together that was essentially a conversation between doctors and patients. So they had 4, 5, 6, it was ophthalmologists and optometrists. And there were 4 of us that were patients, patient advocates, people running organizations, whatever, but definitely on the patient side. And it was this 3-hour session. They had a plan for it and they had slides. There were topics we were supposed to go through, but it really ended up, we were all pretty pumped and energized about the conversations we were having. So we kind of laid a lot of the agenda aside and just went for it. And our main theme was, how do we bridge gaps to where doctors and patients can have better communication? And I mean, kind of what's lying behind this particular company is trying to figure out, how do we teach eye doctors how to talk to people with dry eye? So our conversations went all over the place, and it was pretty exciting. At the end of it, it was just really neat to see these eye doctors. They were all doctors that have some stature in the dry eye world, right? They know what they're talking about. They're really attuned to this stuff. You'd think of them as pretty empathetic, very knowledgeable doctors in any case, but they all came away with new insights that they were pretty excited about. And they were excited to have heard the patient side of things too. But we also came away all feeling like there's just such a need for better resources and better information. On the patient side, we talked about the things that we're missing, the things that we've needed along the way that were really hard to find information-wise. And the doctors talked about, I wish there was some place I could send people to get better training or information on this and such a dry eye topic. So anyway, that was an exciting thing, just seeing the conversations happen. You could see a lot of wheels turn. These were people who were like, I want to do this again. So it was really fun. Let's see. I'm looking at Phyllis's comment about using the term ocular surface disorder elicits a far different response than dry eye. Yeah, absolutely. That was actually something that came up in this ad board from the other day that I was so happy about. I mean, in that sort of context, I always do my personal spiel about this. I tell them I don't really believe in dry eye disease as a name. I think it's about ocular surface disease on the one hand and ocular surface pain on the other hand. And but there were other doctors there that were echoing that. That was really fun. There were a couple there that were already really strong proponents of having their patients even use the term ocular surface disease in general rather than dry eye, just because it brings up a different image. Doesn't have the trivialized baggage that dry eye has. And it's more accurate, really, because so many of us with dry eye disease, do our eyes actually feel or look dry? Not necessarily. We use dry eye as a bucket for so many different types of things, from people whose tear secretion really is reduced or just gone, so what we call aqueous deficient dry eye, your lacrimal glands aren't putting it out, to people who produce plenty of tears, but their meibomian glands aren't working right, so they have evaporative dry eye. Then there's people who all of their tears may be fine, but their lids aren't closing. So they're losing too much to exposure and they got a lot of pain with it, to all kinds of ocular surface disorders that, including, ocular allergy and lots of other stuff that may bring the same symptoms as dry eye. It just gets all mushed into this bucket. And I think we're better served when we call it ocular surface disease and when they get down to specifics, most of all, because none of us just has dry eye. We've got specifically diagnosable things. I just don't even think of dry eye as a diagnosis in its own right. That was another doctor from the other day said that. This particular doctor doesn't allow their techs or anybody to write down whatever the code is for dry eye. They always have them code their diagnoses to more specific things than that, which I thought was really great.
So just on YouTube, we had someone else, it doesn't give me a timestamp, but someone who was agreeing with the thing that we're talking about, which is that dry eye often isn't taken seriously. And they said that they don't think that anyone can understand it who doesn't have it. And that's a reasonable assumption. But I just brought up Dry Eye Stories, which is a site we have with different entries from people. And there actually is a story in the queue from someone on this call that I need to put up. But the idea with that site partly is to make those stories accessible to people who may not otherwise understand those narratives or what people go through with the really trivial dry eye sounding diagnosis.
There was just a really good level of understanding amongst the doctors in our meeting the other day too, that we all need those stories, that we want to connect with other patients that are going through similar things, that we need relatable information, not just medical speak, that the kind of impact on our lives is a key part that we need to be able to connect with people about. All right, is there really nobody that wants to jump in and talk? I hope you'll feel free. This was the day to do that. We don't have a panel. We're not doing anything organized. We're just kind of in here to shoot the breeze. Let me think what else is going on. Aiden and I were working on some planning this morning. We're just kind of getting started with kind of revisiting our Dry Eye Foundation plans in general. And we got a board meeting coming up next month. And what does 2021 look like in a COVID and hopefully not too far away post-COVID world? It's certainly changed an awful lot for our dry eye world and for us here in terms of what we're doing and what we can do. I mean, I would say it's directly a result of COVID that we were even able to get Dry Eye Happy Hour going. Never would have thought of something like that without us all having suddenly become Zoom experts, just out of necessity. So we're looking down the future here of what we're going to be working on this next year. And a lot of that centers around just plain conversations about dry eye amongst us, amongst ourselves, like we've been doing on Dry Eye Happy Hour. Conversations between patients and doctors, whether it's you in your doctor's office, bringing up a new idea, bringing a new treatment to their attention, asking questions they may not have thought about, or just framing your information for them in new ways to kind of heighten awareness of some of our community's issues. Then there's kind of these broader, larger conversations between doctors and patients too, and finding how we foster and facilitate those conversations. I've had kind of an interesting time this year starting to work a little bit more with industry. And that means kind of setting aside all my attitudes and baggage about the pharmaceutical industry, right? And just asking myself, who out there can make a difference in the dry eye world? Who's got pull and can change things amongst ophthalmologists, amongst optometrists, amongst the whole landscape of dry eye. And unavoidably, pharmaceutical companies are a big part of that. They're there. They have huge influence. And a lot of them have these patient advocacy departments that want to learn more about the communities. And ultimately, is this for selling drugs? Yes, but they can actually do quite a lot of good along the way too. And we do need more and better drugs for dry eye. There's at least one out there being developed specifically for dry eye pain, or ocular surface pain, really, which is a good thing. But in the course of some of that work that I've been doing this year, there was a roundtable, I think I probably mentioned this before, that was like what I talked about the other day, only it wasn't live. It was a forum online that we got to participate in over the course of a couple of weeks on some different topics. One was the patient journey. What does it look like from when dry eye symptoms first start to when things get bad enough that you go to a doctor? What are those experiences at the doctor's offices? How is this playing out in your personal life, in your job, financially? At what point did you start getting some actual help? At what point did things start turning around? What does it look like to get into a maintenance mode or to get better? Just kind of looking at that whole journey. And we all got to pool our experiences. And then they did a lot of analysis on what came out of it. And it was really interesting. We talked afterwards about how if you're doing something live conversations, there's a certain dynamic to that. And there's certain voices that get heard more than others just because of the way personalities work. When it's not live and people can contribute on their own time, whenever is most comfortable for them, there's a whole different series of information that comes out from that. So it was really fascinating to see that. We're actually working on getting the results of that published now. So it should be interesting if we can get it out there. Does anybody have things they want to talk about? A topic, a question? Where does dry eye intersect with global warming and climate change? Rising temperatures, drier air, changes in allergies, California wildfires. Oh boy, the wildfires this year was just, yeah. The air quality. Aiden, have we ever had it so bad here before? I don't think we ever have.
Not that I can remember. Yeah.
In the greater Seattle area, Washington in general, Oregon, California, everybody with dry eye was struggling with the air quality. I was more conscious than ever this year about the allergy factor in things, certain times of the year especially. I'd get calls from people whose dry eye is kind of just like in the last few weeks or month or days even tanking, and they're getting scared because they're going back into really bad symptoms. And I'd be looking at their area code or their phone number, figuring out where they are and going on to, I don't know, pollencount.com or whatever the websites are for this. And so often I would see that correlation that the pollen counts were off the charts when people were having a hard time. I don't know what else to say this other than yes, it does intersect. Environment is a huge part of dry eye. Do anybody remember back in 2005 when there was this thing put out, the top 100 worst dry eye cities in the US? I forget what they called it exactly, but it was a collaborative effort between the, I'm going to get the name wrong, National Women's Health something or other, and Allergan, who were, hot and heavy with marketing Restasis, which had just come out a year or two before that. And as a kind of a PR and educational thing, they put out this list of cities. And it was really interesting because it wasn't just about where are the dry eye climates. It was about many different environmental factors. So you got pollution, you got the allergens, pollen counts, you've got altitude also, and then obviously humidity. So like 4 out of the 5 top cities were in Texas. actually a lot of the cities on that list were in Texas, but not all in the dry cities. There were a lot of very humid cities on that list. I remember Tampa being somewhere pretty far up the list, and even I want to say Honolulu or something. So just there's a lot of different environmental factors that can make things harder on us. Which is one of the reasons I'm always pushing moisture chamber glasses, which are kind of best friend for a lot of people that have symptoms out of control.
I always think of technology, though, kind of intersecting with that, just the dry eye from technology. I don't know if you brought it up in happy hour, if it was just a board meeting when you talked about the study. Was that at TFOS in the Amazon with indigenous people there, the dry eye incidents versus us staring at our computers all day and the manufactured environment we have?
That was see if I can find my notes real quick on that, because that was the TFOS meeting. So TFOS, the Tear Film and Ocular Surface Society, this is the professional body that is dedicated to all things dry eye and tear film, right? And they're relatively small, although they're very influential, but they're not like big enough to have an annual conference like the big ophthalmology and optometry organizations. So they have this one that happens like every 4 years. And I went to the last one, and it's just this incredible time. It's like all of the best brains of the dry eye world are in one place, and it's a club. They all know each other. And there's just this incredible vibe with all of the newest research that everyone's done, and just overhearing the conversations is a really, really neat experience. And at that last one, they had this kind of technology forum that they did after the end of the session one day, where they let any company come in and have 5 or 10 minutes at the podium to explain some really super cool new research that they were doing. It's just really exciting. So anyway, this year, TFOS was supposed to be meeting in Italy, in Milan. And Aiden and I actually were both going to go, and we were hoping to present data from our community's dry eye survey there. And TFOS left it pretty late to when they canceled it, because they just wanted so badly to have it. But in the end, it got canceled and everybody's heartbroken. But they did a small one online, which I watched and was really exciting. And so the paper Aiden was just talking about was presented there. And I just remember to finish searching for this. Yeah, so this was, okay, Monica Alves, who I really like. She was on the epidemiology team in the TFOS DUCE 2 meeting back in like 2016 that I got to be part of. A lot of fun. So they compared a population in Sao Paulo and their rates of dry eye to the Xingu Indigenous National Reserve, where there's basically no electronics, clean air, and a good diet. And they call the study Eyes of Xingu. And let's see. In the country at large, they had found their most recent epidemiology study, there have been very few, showed 12.8% of these 25 million people have dry eye based on symptoms, and I don't know whether other factors, but among these indigenous peoples, there was none. It's just they accounted for that really by, in their study, by just the difference of environment and lifestyle, diet and the electronics. I mean, we know electronics are huge, and obviously everyone who never heard of dry eye is starting to hear about it or experience it now that so many people have been working from home and just having to use computers for a lot longer that haven't been beforehand. Phyllis is saying she's discovering diet and beverage relationships with ocular surface disease. Yeah, I think there's a ton to be learned by just becoming better observers. And some people talk about keeping like a dry eye diary. Maybe kind of logging their symptoms and when they have their ups and downs and finding some correlations with other things going on. You know, I've had dry eye for almost 20 years, right? I still forget, or I'll be having a bad day and I'll realize, I just haven't even been drinking enough water or too much coffee or whatever.
Did you see the question and answer here too, or just the question from
No.
Sean? Yeah, just came up.
Future therapy, lid-centric pain management. Holy Grail, progress on repair of gland fibrosis. Oh, monitoring if your therapies are contributing to the patients. There's so many factors that contribute to the dryness. Is it my Xiidra hot compress? My Predilon is crazy. Yeah, I just relate to this so much. And there's two sides to this. There's all of these different potential parts or contributors to disease or to dry eye. Of all of the things going on with my eyes, eyelids, etc., which one are ones are contributing most to my symptoms? So if I've got a little lagophthalmos and some conjunctival cholasis and a little bit reduced tear production and some MGD and a little ocular allergy, is it the sum total of those things that makes me symptomatic, or is it one thing that I can draw a straight line to my symptoms, right? And then on the other hand, when we're doing stuff to treat it, everything from our prescription drugs to in-office treatments, the LipiFlows and the probing and all these things, to artificial tears, to wearing moisture chamber glasses, to scleral lenses, to less time on the computer. Which one of these things or ones are actually making us feel better? There's so much information that gets lost in the noise, and it's hard to figure how do we combat that? Because when you are uncomfortable, you're gonna do everything you can to get comfortable, right? How is it possible to sit back and bring some patience into play and become more methodical and say, well, I'm just going to change one thing at a time and see what that does. It's a hard thing when we need to do lots. I mean, I think that a lot of what we with dry eye face is we are so comfort driven. We're going to respond in the moment to what's going on in the moment. I guess personally, I like to divide things into the medical side and the comfort management side, and say, if I'm going to change anything on the medical side, a drug, a procedure, I don't know what, then I want to change only one, but make sure that I have enough comfort management that I can actually stick to it and be consistent and be content to just have that one thing changed for a while and then reassess. I think, one thing I hear from a lot of people is, doctor hopping amongst dry eye patients is just the norm. Everybody seems to have been to a whole lot of different doctors, right? But I hear from people that, okay, I'm on doctor number 3, 4, 5, 6, 7, whatever, and they want me to start over. I've already done Restasis. I've done this, I've done that. None of it worked. And I get frustrated when a new doctor says, I want you to do this. And you feel like you're just repeating something you already tried that doesn't work. And yet, there's some validity to it potentially. That doctor hasn't seen your history or your progression. They haven't seen how things affect you clinically. They haven't had that opportunity to see, okay, what did your eyes look like before you went on Restasis for 6 months and then after? And if there's no change, okay, that's one thing. But what if you discontinued a treatment because you weren't feeling better? But what if clinically they might have actually seen some progress or some improvement that maybe brought a clue as to what was going on or what other things might work in the future? So doctors want to see it all for themselves and be able to validate that. There's also often, I think, they may want to do things just a little bit differently. Sometimes small nuances and differences in how you do a treatment, a difference to a dosage of something, or a different tool for a compress, or a different method for massaging your lids, or a different lid scrub. These things just can make a dramatic difference. Things that you would think are pretty small. Just thinking about somebody actually that I talked to the other day where it's like they tried a whole lot of things and nothing was helping. And then Avenova just happened to be the one that did help with them. And under circumstances where, boy, I never would have expected that, but it was. Sometimes we get surprises. You just try different things in kind of the same category and it can make a difference. Phyllis, any more you want to share about diet and beverage relationships with ocular surface disease or with symptoms?
Nope.
Okay.
He's gonna join us, I think. I just saw her hand go up. I don't know if you've been talking. Oh, there we go.
Sorry, I've been noticing that if I exceed my 2 cups of caffeine in the morning, my eyeball itself, as well as the surface, definitely seems to be affected. I'm noticing that anytime I eat, and I don't eat much prepared food, I cook for myself all the time. And I'm noticing sometimes when I eat prepared food that's kind of high in sodium, I'll have that same, it's just like having dry mouth when you eat too much salt, or and I'm also noticing I'm a wine consumer, and I recently have switched to buying organic grape wine, and I'm noticing less discomfort to my eye.
Wow, isn't that interesting?
Yeah, because again, it's all the things that sprayed on conventionally to make wine. Just like I really I stay away from preservatives in anything that goes in my eye. I try to avoid preservatives in my mouth. So yeah, I'm just kind of, like trying to be the observer, like you talked about. And I also keep kind of a daily food journal because I have other health issues. I have vestibular schwannoma, also known as acoustic neuroma. And just figuring out that certain foods will make certain side effects more noticeable. And like you said, we're all pretty comfort driven, and it's a journey. I've been on the acoustic neuroma journey for 20 years. I've probably been on eye journey of some sort for 45 years. And sometimes I get a little pushback from physicians. Occasionally I'll hear and where'd you go to medical school, little lady? And sometimes that's a little disconcerting. I feel like I'm being minimized.
Yeah, that's about as condescending as it.
I agree, and if I hear that more than once from the same physician, I will find another physician,
Good physicians know that they need to be in partnership with their patients, and they know that the better educated their patients are about medical condition, the better they're going to do. They're going to be involved in the decisions. They're going to be paying attention. They're probably going to be more compliant with treatments if they understand what the purpose is and why. And I think good doctors ought to be humble enough too to listen when somebody's bringing them information and get involved. So yeah, my tolerance level for that kind of behavior is pretty low. Thankfully, I mean, I think culturally that's just gradually changing, and I think we're going to see less and less of that in this day and age when there's so much information that's available to us. I certainly know tons of doctors who love to have their patients as educated as possible and give them links of things to read as well. I know doctors get frustrated with people who just kind of pull down random information from the internet or say, well, I learned this on my Facebook group. They want to know that you're getting stuff from reputable sources, but they should always be willing to talk about the information itself. Speaking of, I mentioned I was at a long eye doctor appointment last week. And this was one of the, I haven't had many eye doctor appointments this year since the shutdowns and everything started. And different offices have different protocols. This particular eye doctor I'd never been to before. It was a large surgical center over in Seattle. And one of the new things there that I hadn't experienced before was all of the exam room doors were open. And so there's basically no privacy. I overheard a lot of conversations I'd rather not have heard between other patients and their doctors. And the doctor's standing in the doorway with a scribe out in the hall taking notes. And for me, I found it very difficult because the new doctor I hadn't met, they didn't allow any talking when they were at the slit lamp doing the exam. And then they're standing there in the door with light behind them. I'm in an exam, so I don't have my scleral lenses in, which means I can't see their face. I can't get any eye contact established. So it was a hard one. And this is one of the nation's best in their particular field. So I knew I was getting good information, all that, but it was still very hard not to really have a chance to get a relationship going or have the kind of conversation that I tend to expect to have in doctors' offices. I'm just curious what the rest of you are experiencing in that regard. Because I'd been to a couple of Kaiser doctors and didn't have that. I was able to be closer and have better conversations there. So just curious what it's like for the rest of you in a COVID world going into eye doctors. Phyllis, have you been in the course of this? Imagine you've seen.
Actually, no, I have not been to the neuro-ophthalmologist that I had seen for several years, moved to a different part of the country, and I got reassigned to another neuro-ophthalmologist, and I saw her once pre-COVID, and I've kind of not been able to see about getting a follow-up appointment. Let's see, just about other physicians. I saw my neurosurgeon not too long ago, and he does face-to-face in the office. Just, it's the same as it's always been, except we're now wearing masks. And some of my other physicians were doing only telemedicine.
Mm-hmm.
So, and obviously telemedicine doesn't work for going to ophthalmologist, and, so we're just struggling in this COVID world. Everybody wants to be as safe as they can and, limit their exposure, saying, healthcare people as well. So I'm just sort of hoping that maybe by the middle of 2021, things will have settled down to a new level. And hopefully I can, get an appointment with the neuro-ophthalmologist and kind of see what's going on. So I'm just sort of in the maintenance mode. And thanks very much for doing these happy hours. And I'm really enjoying being part of this community. It's I'm learning a lot, and my list of questions for when I get to see the neuro-ophthalmologist again has gotten very huge from things that I have learned from this community.
Well, that's great. Speaking of lists of questions, One of the things I did before my appointment last week, and something that I always find myself encouraging people to do, especially if they're seeing a new doctor, but even seeing an existing doctor, sometimes it can help, was put together a summary of my situation and my concerns and my questions. And I mean, it was as compact as I could make it. But I faxed it to him about a week beforehand. This was an appointment that was kind of scheduled way out. Um, and it helped me. I know it helped the doctor, but it also just helped me feel more confident that I wasn't going to forget anything or have anything kind of lost in the conversation there. And kind of going back to how things were set up at that doctor's office, I was super happy with it from a safety standpoint. It was just this communication thing that was rough, but that made me doubly happy that I had sent information beforehand, because I just don't feel confident I could have gotten across all the things I needed to if I'd had to do it all verbally there in the circumstances of this specific one. And usually when I talk to people about sending in a summary, most people have just, it's never occurred to them, wouldn't have thought of it, didn't know they could do that. But it's something I would encourage everyone to do, especially if you've got, maybe complicated concerns, or you're worried a question might not get answered. It's just so helpful. This is something an ophthalmologist friend of mine taught me a really long time ago. Partly just, you stand out when you do something like that. I mean, you're probably the only patient in days, weeks, maybe longer that has done something like that. So they're noticing you, and they go into the appointment better equipped potentially, and it can help keep things focused. For me, because the nature of some of my questions was just a little bit maybe less conventional compared to what this doctor would expect from someone going in the same circumstances, I needed to be able to get across my priorities really clearly and say, this thing is totally not important to me. Here's what matters to me. Here's what I'm trying to accomplish. And here's what I'm trying to avoid. And I think in dry eye, those types of things come up too. We're all coming from different places. Some people are, bring it on. How many more drugs can I get for this? Some people do not want to go the medication route. They want to get as many natural treatments as possible. Some people want to do more with diet and things. It can help to get that extra preparation out there. Have your doctor have this noticeable heads up beforehand that, hey, there's something a little different and unusual here, and I can walk in the door kind of prepared for it. I think it's just a useful tool to advocate for ourselves. Let's see what else. And I'm finding myself circling back to the call log to see anything interesting that's come up.
Yeah.
Do we have scleral lens users in the group here today? Or am I the only one? Sean. Okay.
There was that new hydrogen peroxide CooperVision, the refined one step that came up in a call this week. I wanted to know the size of the case on that.
Right.
Because we had a patient using that with their lenses. A patient, a caller.
What was it called? Refined one step. I know I got it on my list of stuff to look up and find and get more details on. I think I'm pleased to see more hydrogen peroxide coming out, because we've just had one for a long time. We've got ClearCare, and we've got ClearCare. We've got ClearCare. We've got ClearCare and ClearCare Plus. But there used to be, what was it, Peroxicare or something? I forget the name of it. There's a Bausch & Lomb one that was discontinued years ago. There have been like drugstore generics from time to time. I think most of those have kind of gone by the wayside. But with those ones, I always hear about people saying, oh, the catalyst doesn't last as long, or the thing doesn't bubble up, or didn't seem to be quite as good. seems like I got a case from one of those generic ones also and just found it kind of either smaller or a little flimsier than the ClearCare one. I know at least one other company that's working on a new peroxide product as well that is going to make a larger case. And unfortunately, I think it's fairly far in the future, but I'm really looking forward to it. We've gone on so long. Those of us that have big lenses and need the big case, we've got the pros case that Boston Sight makes, which it's fantastic that they're able to do that. That kind of manufacturing is so expensive and hard, and you can't just kind of go back and tweak it when you feel like you need something different. So nobody ever is happy, particularly with the cases, but it's all we got. But to use it, you got to get the ClearCare and then break the catalyst thing off of the ClearCare case and put it in the pros case. It's just a bit of a rigmarole. So I'm looking forward to the industry kind of catching up with some of these needs and coming out with better stuff for us. We saw that happen with the preservative-free salines for scleral lenses. We went from having Unisol 4 for forever to having nothing when it got discontinued, which was terrifying, to having PureLens, and then Menicon Lacropure came out, and then Scleral Fill, and now we've got Nutrafil. And so even if one of those goes on back order for a while, like happened with Lacropure a couple times, we've got others to fall back on. So we're in a lot better shape than we were. I think product discontinuations and shortages that just plagued our world, both in scleral lenses and in dry eye. There's the Lacrosert for dry eye. Anybody here ever used Lacrosert? They've been around for forever, right? But they've kind of come and gone because they change hands and the manufacturing facility doesn't make any for a while, or they change manufacturing facilities. But Lacrosert was gone most of this year. It looks like Sean's used those. Are they still really priced like that? Wow. I'm just relieved that they came back. I was worried when they disappeared this year. I was like, it's a COVID year. Industry is struggling. Is this the year that they kill the Lacrosert and it never comes back? So I'm really pleased that they are on the way. Then we had Refresh PM gone for a couple of years. Okay, I haven't used them in a decade because they don't work for me, but that's how I remember it. Yeah, Lacrosert are like a handful of other things where there's a certain number of people, relatively small number, but it's like the one thing that works for them when nothing else does. So you just want to see these companies keep nursing along those products and keeping them around. So sure miss them when they're gone. Let's see. And then we had TruTear. Anybody here used TruTear, the nasal stimulator thing from Allergan? Sean? Again, yep, you're the one that's tried everything here. I've done a lot of people that used it, some pretty successfully. They quit making it this year, but also are refunding the TruTear devices to anyone who can like send it back or provide proof of purchase, I think. So it's nice that they're doing that, but it's a bummer that it's gone. We do have lots of new stuff coming out. In fact, let me put a little link in here. I just updated the dry eye drug and device pipeline page recently after probably not touching it all year, unfortunately, but it is up to date. I'm just going to post a link in case anybody's interested. There's a list there of some things that have recently or relatively recently been approved. And then a bunch of other things that are in clinical trials. The one on here, honestly, that I think I'm most excited about is an over-the-counter product, and it's the Alloway preservative-free. It's the first allergy drop in the US to not be preserved. And we've needed something like this for so long. It's just crazy that we haven't had one before. That's going to be over the counter. It's not going to be around until the spring, but I'm really glad that it's coming. So we finally got both steroids and allergy drops out there that are preservative free. And another thing on this list, iTear 100 neurostimulator. I came across this on an optometry podcast. Haven't really heard about it anywhere else, but interesting. It's kind of similar to the TrueTear device. And then there's a drug in process that from Oyster Point that's going to be a spray that's supposed to do the same thing as the TrueTear sort of, which is kind of cool because honestly, I'd rather use a spray than stick something up my nose personally, given the choice.
Sean had another question about Tangible Boost, if it's ever going to get here.
Ooh, Tangible Boost. So I saw something about that on the Facebook group. Bear with me a sec. One of these things I haven't kept up with as much as I'd like. I thought someone put a specific time frame on that recently. Somebody posted in October about having the chance to try it at their doctor's office. And let me find what else. Thought I saw, I'll find out and get back to you. I thought I saw someone say that the FDA clearance had actually come through and it's just a matter when they were getting it on the market, but I don't remember exactly. I'll find out though. I do know doctors that are using it that are reasonably happy with it. I mean, it's a prescription thing, right? It's going to have to be reapplied pretty darn regularly for the people that need it. But I think for those cases where it's really needed, it's going to be important help, especially if, some labs will redo the HydroPeg coating and others won't. So for the ones that won't, the idea of having to replace your lenses just because the HydroPeg has worn off, that's just a hideously expensive thing to have to go through. So just being able to keep the lenses going longer, I think, will be a really important benefit of that. And did you have something else, Sean? I see an also on there. Will Tangible Boost ever get here? That's what I kept asking. It was like coming soon on the website for forever. But I think these FDA clearances sometimes can just take a really super long time. All right, let's see. Okay, HydroPeg is great for a week, but it wears. It's wearing off for you literally in a week. Wow. Yeah, there's such a range of us, aren't there? I mean, with the deposits and the wetting problems on scleral lenses, it's an area we're really looking forward to better technologies. And one of my big concerns about that all along has just been the balancing our needs between getting lenses really clean so they're as safe as possible, right? And getting them comfortable and clear vision. And for those of us with either lots of dryness or getting lots of deposits on the lenses, HydroPeg can be really important for accomplishing that. But then you also can't use the super cleaners. You can't, well, Lobob's no longer around, so that's not even an issue. But you can't like Progent your lenses because it'll just take the coating straight off. Although I suppose if you're doing Boost, it might get interesting then. That might open up other possibilities because maybe then you basically Progent your lens. If you're doing the Boost every month, Progent the lens and then do the Boost. I have to learn more about that, see if that can be done. All right, well, we've had a long week here and I think I'm going to look at kind of wrapping up soon. Anybody got other questions or thoughts they want to throw into the mix? All right. Sure appreciate everybody showing up and being part of this. Today was a little bit different. Like I said, no panel. This is just chatting and seeing if anybody wants to jump in. So we are still planning, we're just finishing, kind of finalizing dates, but we are still planning, hopefully in December, maybe mid-December, having a happy hour session where we get our Dry Foundation board. So you guys get to meet all the people on the board and kind of talk about what we're doing other than happy hour. So we'll let you know. We'll have an email blast out about that soon.
Yeah.
Thanks for the note, Sean. So glad. However we do it, and however formal or informal, and with me, everything's always informal. I just really do think connection is more and more important. Stuff like this is isolating, and you can only get so far even with forums and Facebook groups and stuff. Sometimes seeing that there's a real flesh and blood human being out there dealing with the same things just is pretty important. So let's see, anything you want to share as we wrap up, Aidan?
I think aside from that, we're always available by email, phone, on our website. Dryfoundation.org has everything you need to get in contact with us. And please reach out. I've been enjoying getting foundation calls or talking to people, just being able to get a little sense of what they're going through, and usually get them scheduled to Rebecca, but I always love to hear from people.
All right, well, be well, everybody, and we'll see you again soon. Hope everybody has a good weekend. Okay.